On this podcast of the Back Pain Rant, I'd like to just talk a little bit about what prolotherapy techniques can be used for chronic low back pain or annular tears. There's certainly a paper published back in the 90s about the injection of a prolotherapy or proliferant injected into a painful low back. And you might first ask, what was the prolotherapy injection? Hi, I'm Dr. Tony Mork, orthopedic surgeon, endoscopic spine specialist, and we're talking today about what prolotherapy is and how it might apply to back pain issues in current day thinking. One thing I became exposed to prolotherapy, which is really the injection of a concentrated dextrose solution. So if you want to simplify it, it's almost sugar water. You can get a D50 or 50% solution and dilute it in half, either with some lidocaine or some saline, maybe adding a little steroid to it. And then once it's in a 25% solution, you can inject it into a painful disc, which was done in a paper back in the 1990s by an orthopedic surgeon, Dr. Bjorn Eck, EEK. So they, I don't think, really 100% knew what they were dealing with back then, but they were injecting some painful discs with this prolotherapy or this proliferant injection. And what they found was that people had about 60% relief of their back pain, although it could take up to 9 months. So here we are, a simple injection. That's it, just a simple injection of something extremely benign, dextrose 50% diluted in half, injected maybe once or twice over, and within 9 months, people had at least a 50% reduction of their back pain within 9 months. And I looked at this, I said, geez, this is amazing. You could have any kind of back pain relief, not as much as 60%, occurring after a simple injection of some concentrated dextrose. How could this be the case? So, and they have done some studies of what happens when you inject dextrose into soft tissues. And one thing that did happen, it generates an inflammatory response. And in this case, the cells will get thicker and larger, and it actually stiffens up the soft tissues as well. So in a way, it strengthens up these soft tissues. I've noticed that just in doing discography and some of the surgery on these bad discs with annular tears or degenerative changes, that the discs are kind of mushy. They have a feeling to them that it's not a nice solid feeling. It's one of a lot of giving way. So the soft tissues, for whatever reason, are really not strong. They're kind of weak and probably give rise to really what people refer to maybe as micro instability. So what happens with the injection of the proliferant or the prolotherapy injection is that it probably generates an inflammatory response. Typically, people's backs are sore for maybe a week or 10 days afterward. And they can do whatever they want. There's no rest. You don't have to do anything. It's just that the solution's in there. And how could this possibly work? So really by coming in contact with the annulus on the inside, because you've injected the solution on the inside of the disc, the cells begin to respond with maybe a little inflammation, which again stiffens them up a little bit and maybe gives rise to less kind of this lax motion. But I think the other thing that can happen is that the solution might be so strong as it leaks out of the annulus from inside the disc to the outside and comes in contact with these small C fibers, the pain fibers in the annulus, that they may not be able to survive such a concentrated solution. So the solution is fairly benign for the body, but it may be toxic to the small pain nerves in the annulus itself. And I think this is a topic for further exploration in general. But I think it's an interesting phenomena that you can actually do something as benign as just an injection of this dextrose solution, and with an expectation of 60% of people experiencing a significant relief of their back pain. And exactly how it works, as I said, it might just stiffen up the tissues so that the disc is less compliant and a little bit more stabilizing in nature. It also might be making an environment where the little C fiber, the pain nerves, can't really survive, and they basically are diminished in number. But a very interesting topic that I think is worth exploring. I've not done that much these days, but it's, again, a very benign way to approach chronic low back pain. Thank you very much for listening to this episode of the podcast. I invite you to ask more questions and subscribe in the event that you're interested in hearing more about different problems with respect to the back and endoscopic solutions for those problems.